Hi.
Good afternoon. I think I was a bit quick off of that, Mark. It's good afternoon. Well, thank you all for joining us for the latest in our global series webinar, which is looking and celebrating the successes of the International Nursing and Midwifery Associations. And we're really excited to have a panel of fantastic experts to share their successes and experiences in setting up and setting up INMAs and actually sharing what they've done and how they've really made a great impact and difference. I'm Lucy Brown. I'm the Director of Nursing and Midwifery Leadership Development here at the Florence Nightingale Foundation. And one part of my role is to help host the webinar series across for all of our members and our alumni. And it's my great pleasure to welcome Marsha James with us this morning, who is from both the Caribbean INMA and the Society of African and Caribbean Midwives. So welcome, Marsha. It's wonderful to have you this morning. We've also got Jenny Hagurula here, who is our new head of global. So welcome, Jen. Jen's going to share her experiences working with internationally recruited nurses and midwives. We've also got Sarjan Satyan, who's from the Malawi, INMA, who'll be sharing his successes. And last but not least, we have Oliver Serrano, who's from the Philippine Nursing and Midwifery Association as well. So before we get started, I'm just going to share my screen and give a little background on how the Florence Nightingale Foundation has worked with the INMAs. I'll just quickly go through the agenda as well. So one moment, I'll share my screen and we'll get started. Just to make you aware, we will be recording today. So if your colleagues weren't able to attend, I think it was a bit of short notice, you can share the recording with them far and wide to catch up. I'm just going to share my screen. Just one moment. I just confirm you can see that okay? A nod to the room, thank you. Okay, so welcome and overview from myself. Then I'm going to hand across to Jen to give work so far, so a lot of work that Jen has done on the agenda. Marsha will give an overview, as we've said earlier, followed by Sarge, and then finally Oliver, and then we'll have time for Q&A at the end of today's session. So I just wanted to share a bit of an overview with you of the INMAs. Now they were set up, the funding was set up a couple of years ago, but the INMAs, some of them in formation for many years. Some, I think the Caribbean and Jamaican Association have been around for about 40 years. Is that right, Marsha? But what's been really great is the Florence Nightingale was commissioned by the International Recruitment Nursing Team based at NHS England, an improvement, to fund and support with the small grants. Now, for those of you who aren't aware, the International Nursing and Midwifery Associations are a group of leaders who come together to actively support and connect nurses and midwives and their families, which is really important, who live outside their shared country of origin, who've come to work within the UK. And really it's about building that sense of community, welcoming people into the UK to work and helping them to settle. The small grants were set up to support the formation of some new INMAs, but also support the work of those existing INMAs that I spoke about just now. And what's really exciting, in the first year of the small grants, 11 grants were granted or provided to the INMAs, but then this year we had a second tranche where obviously the support has been widely praised, and we've had 24 INMAs that were awarded small grants in 2022. So what's great is Oliver, Sarge and Marsha will all share their successes and what those funds have done and how that's supported the wider community, which is really great. And through that, members have used it to support pastoral support, improved health and wellbeing, and also that really important professional nursing midwifery support to help people settle into country and feel at home and support them with their homesickness. But that's enough from me. I'm going to pass across to Jen, who's really going to share a background of her work. So over to you, Jen, and thank you so much for joining us today.
Thank you so much, Lucy, for giving us that introduction. And my next 10 minutes, we'll be talking about the work so far that we have done in NHS England. And the first question that I wanted to pose to you is, are we learning from history? And you can see what I've put on my first slide in terms of the Windrush in the 1950s and how we have called nurses in to come and support the newly established NHS. And then Twitter is so good, isn't it? Because we have photos that we can just grab. And this one is a photo of Filipino nurses arriving as well in the 1970s, coming to support again our beloved NHS. And I myself came in 1999. So there's a 20-year pattern in history of recruitment. I think as Lucy has introduced, I will be working with Stuart Tuckwood on our global agenda within the Florence Nightingale Foundation. And this is really to do with trying to establish what we have started within NHS England and make sure our INMAs are sustainable and we are really able to carry on the impact they are doing now. Next slide, please. So the aim of this project was to scope, engage, and connect with the different associations across NHS England so that we can enhance their pastoral and professional support for their members. So we want to work in collaboration with them and have that collective voice on issues that concern international nurses. So the method that I did when I started this project was to scope what are there. And in November 2020, we had the Jamaicans, the Nigerians, the Indians, and the Filipinos as established associations. Some have been there for a long time. And then I'll talk you through the process where we have talked to these INMA leaders and learned about what are the things that concern them. And first and foremost, the task that Duncan, our director of IR, gave me was to do a roundtable on the parallels that we have with Windrush and what have we learned from history. And there you can see on one side, the same concerns that actually are the challenges of our members within the associations, down to the very basic things, the need for shelter, the need for having stability within their job, being able to integrate that sense of belonging and being able to be valued for your own contributions and how you fit in to the UK society. And on your left side, you have the same similar themes. And I'd like to drill down on some of the basic things on the next slide, if you go across, Lucy. Because as you can see, when I spoke to the leaders, we then see that they want to support these new nurses who arrive in the country. They want to also support the ones who have already been here because they realize that their progression has not been as quick. So the interview skills, the academic writing, how they go through HR issues, these are really vital in terms of your job satisfaction when you are working in healthcare. And there's a common theme about giving back. And I think that's really exciting because we have plans to really make sure at FNF Global that this is going to be realized. Having a voice comes strongly as well, because never before in the history of the nursing workforce in the NHS that we have got this collective of different nationalities coming together every 6 weeks, talking to stakeholders to make sure that their concerns are heard, and also we have some actions that follow through with them. And the other thing, and as an aspiration, one of the leaders wanted to promote the NHS to its mother country, and that actually is a good support for international recruitment. As you know, need for nurses is global. And in terms of challenges, this is where we thought NHS England had tried to respond. As you can see, financial is the main thing. How do you sustain an association? So Lucy alluded to the small grants. We have the first and second tranche done, but we also had COVID-related funds with the Omicron funding, which we were trying to give out in December. And that really helped in making sure we have our nurses being supported when they are in isolation. And it was a really new thing, especially with the pandemic. And engagement and that representation, I think, is so key when we have these associations now, because one of the aims of NHS England would be really to increase your profile at different levels across England And that means that the trusts know about you. They can get in touch with you if they have new nurses that arrive. The other thing would be to make sure we have our fellows already in the different parts of the country, again, raising the profile of their association, but working with their INMA leaders to make sure they have projects within their association that they can deliver in 6 months. That's also new. And I think the exciting bit with this is the leadership development of our fellows, but at the same time, our leaders, which again is a future plan as a collaboration between Burdett, NHS England, and FNF. And on your right side, you can see the list, how we have grown from 4 in 2020 to 24 different associations, and we are still actively scoping the ones that we have not got in the top 20 nationalities of our workforce, which is Romania, Portugal, and I forgot the other country, but yes. Next slide, please. And to conclude, I think there is a way of something good about connecting with each other and having that collective voice, and an opportunity as well for our networks to engage with the global agenda that we have now at FNF. And my ask earlier on is, are we learning from history? And I'd like to say we are. And I think that the future is really much better in terms of making sure we provide better support for our international recruits, but at the same time for our ethnic minority workforce, because at the end of the day, we want to have an inclusive and compassionate culture in all healthcare settings, not just in the NHS, but outside in social care and the other areas that we work in nursing across the country. So I'll end with saying we are more connected than ever, but that does not mean we are automatically coherent. But the more connected we are, the better we can work together for broader benefit. And the more connected we are, the more quickly that disruption, the positive impact of our associations can spread. Thank you for listening. And we go over to the associations.
Thanks, Jen. Thank you so much for giving that background, such insight and such wonderful work that's been done. 4 to 24 is incredible and still wanting to do more. Now we're going to hear from the associations now. First, we have Marsha, who's representing 2 associations, the Caribbean Nursing Midwifery Association and the Society of African Caribbean Midwives. Marsha's dual trained, a nurse and a midwife, and is going to share her insights and successes as well from the INMA. So thank you for joining us, Marsha.
Oh, hi. Thanks, Lucy and Jen. Well, firstly, I should thank Florence Nightingale Foundation for supporting the work that some of the existing organizations have already been doing. So today, it shows that intersectionality, not just across the characteristics are real, it also shows in organizations. So I'm representing both today. So for the Caribbean Nurses and Midwives Association, just to give you a bit of context, that there was some informal working that has been going on with this group for perhaps I would say about 5 years ago. But somehow because in the back of the pandemic, we expedited that because we could see where history could potentially be repeating itself on the back of the learning we've seen from the Windrush generation. Now, the Caribbean Nurses and Midwives Association, it's first of its kind, because it's first of its kind in the sense that it brings a collective number of different nationalities together, and specifically from a region. Those of you perhaps who are into region or insights about how the world is set up, CARICOM has been set up and it predates the European Union. So if you get a bit of ideology there, so that's where the idea of bringing us together. So I'm one of the founder members, one of 4. So you've got myself, who's dually qualified, who works in the NHS as a deputy chief nurse and currently as an interim CNO in my organization. You've got Marina, who is also dually qualified, but a senior midwifery lecturer. You've got Paulette, ex-director of nursing who currently works as a NED and cross-cut different organizations like myself. And you've got Jacqueline Gabriel King, who's the head of midwifery, but we're all duly qualified. So if I then move on to just say, what we set out to do was to drive change towards the improvement of health and social care, education, workforce, and policy development, because we know as an organization, we have the potential to do so. So one of our first successes is that we were able to align ourselves to the CARICOM partners who obviously have their high commissioners here in this country. And we're involved in work that is happening both locally here in the UK, but also in the Caribbean region, looking at nurses and midwives. So that's one of our first success, I would say. The second one, and as an organization, not blowing our own trumpet, I would say we have covered ground really quickly in some of our achievements. The pastoral support, I must say, it's one of our strengths, and that in how we deliver that through safe spaces where we bring some of our international recruited nurses and midwives together in that space, but also people who have experiences who would have had some of those challenges. And on top of that, we do one-to-one support, so they can contact us. We've even had, we're not a union, however, in a supportive space we've had where we've engaged with chief nurses to escalate some of the dire concerns that some of our international recruited nurses have brought to that, and we've had favorable outcomes. The other sessions that we do run, every other month we do have a meeting, but then we have a presentation that is open to general members. So in the past, we've had the chief exec of North Mid, Dr. Nina Osuja, who come and talk about leadership. We would have other topics that are topical at the time, safeguarding issues, sickle cell, and so on, to engage with our members, not just our international nurses and midwives, but to actually upskill people. We have a platform where we share timely information. So when publication comes out that may not be disseminated to everybody, there's a timeliness that whoever you are, you can get access to that. We do sessions around goal setting, health and well-being. We're quite heavy on that. And because it's Caribbean nurses and midwives, we also have specific maternity aspects, but the aim is to have a generalized approach in how we do the delivery. So those are some of the high-level successes, I would say. We create, we're very much into the sense of belonging. So around Christmas time, when people may be feeling a bit bewildered, we get people together and they're able to get into that reflective space where they talk about what they would have done at home and stuff. So just give you moving forward with some of the funding that we've received from FNF, we've got our pastoral work continuing, where we will then be having face-to-face meetings and other activities to support our international recruited nurses and midwives. So those are, I would say, I'll pause there just to give a flavor of what we do in moving forward. So then moving over to the Society of African and Caribbean Midwives, you'd have then heard from the outset that I sit across both and I'm dually qualified. On this platform, it's Black midwives. So it's a professional group and an ethnic. So they're all Black, wherever you're from, and your professional space that you're midwife. So whether you're into research, management, education, you name it, that's the platform for you. It's very profession specific. A bit of context, it was founded back in 2014 by Wendy, that some people may be knowing on the platform, who now sits and work in Jacqueline Dunkley-Bent's team, but due to conflict of interest, stepped out of that and handed the baton over to me a couple of years ago. Not quite sure if it's for my sins here, but so on the back of that, we have a leadership team, which you'd figure out. I'm probably the only one probably operating in a full-on nursing midwifery space. My other colleagues are all operating in a specific midwifery space. We've got Abiola Jinadu, who's a director of midwifery. We've got Pauline also, who is a maternity matron, and other colleagues who sit in our wider membership team. Now, the back of SOAC, that was driven on some of the concerns that we have heard come in the past around how Black midwives were treated in that space. So that expedited the formation of this group. But what this group has set out and some of their successes, the first thing that we did last year was collaborative working with the Association of Asian Midwives. So it's also the collaborative piece. I think it's equally important to understand that we're in the same storm, but traveling in different boats. It's imperative that we understand that. So it's about understanding how your problems could be similar and how we join hands together. So we had done a piece of work where we engaged with our midwives, and we called it What Do Black and Brown Midwives Wanted? And that was public, in the Royal College of Midwives, and it was also pushed nationally to support organizations to understand how they can support Black and Brown midwives in their workspace, that year on year we could see they're having really poor outcomes in their experiences at work. In addition to that work, we also do suite of training. So we were creative in our thinking, and we do things like At Your Best. So that was about looking at image and impact in the workplace. How do you present yourself? And that was done taking into consideration the Nursing and Midwifery Code of Conduct, really tying that together. The other piece that we've done, which was quite interesting, and I thoroughly enjoyed that, and that's a continuation work to be done, was about Black mothers in conversation with Black midwives. And that was done on a platform, understanding, really picking at the Embrace report, looking at why Black mothers were 4 or 5 times more likely to die in childbirth. And we had also collaborated in that space. We had 5 times more presenting their work. And out of that, we could see some of the nuances that we've not been able to really unpick, and that there are further conversations to that to go forward. There's been an ask that we now need to bring on our Black obstetric and gynecology colleagues on board to have that wider conversations with our midwives. So that's watch the space that is to come. Other work that we've done, it's around challenging work such as self-limiting beliefs. We've had a social where we just got together, dance, ethnic people any culture for whatever you look like. Food, fun, dance, chatter always does that. So we've had events such as that. We're now really zoning in on our international recruited midwives to do bespoke work with them to support their transition into their place of work, because I guess anybody who's in a specialist role, you would understand your skill sets that you come from in a different country. Despite they are your strength, arguably they could also be a weakness, and it's about how we support people to move forward into that space. And just to share a testimonial, because one of the strengths in SOAC, and as you had mentioned, different people sits across. So we've got members who are sitting in the Nigerian Nursing Association group, Kenya, Zimbabwean, but as I said, it's Black midwives together. One of the positive in that is that we then enable ourselves to have the safe space conversation. They have timely access to information that would be, we have debates about things. We're able to share things around CPD, that, continuous professional development that people would not be aware of because their head is so down in delivering babies that their health and well-being and how they can develop themselves further. There's also a session that is run that if you're newly appointed into a role, we call it getting ready, because it's not just about being successful in the interview, but it's also going forward. How do you sustain that? I think I noticed Karen has been on board Shiny Minds. We've been in discussion as well about getting the app into that space, because I'm a really advocate of, health and well-being. So those are some of the highlights that SOAC does. But to give you a bit testimonial, there is one that I received recently. 2 I'll share, and then I'll close. There is an African proverb that says, "It takes the whole village to raise a child." Since I joined SOAC, I have felt a sense of belonging, I feel valued and listened to, and the encouragement and support given to everyone has been genuine and heartfelt. That individual has started a new role today. Yesterday, so I've just texted her asking her earlier how was her second day or how was the week been. And then at the weekend, I've had another midwife who sits across both CNMA and SAWAC, who have really pushed to apply for a job. She's been successful, going from an 8A to an 8C. And this was the text message I got on Friday evening. Thank you so much for everything. I really appreciate you. I could hear you saying in my head, you can do it. Do not self-sabotage. I've gotten the job. So I'll pause there, because those I could sit here and talk about all what we do, but those are the testimonials that really makes it happen. From a membership perspective, our founder members and our committees are both across both organizations. We do not charge our members everything, because the financial hardship is real. So everything we give is of ourselves. So we explore different options as to how we could support the work we do. So thanks to the platform, Lucy, to share that. And back to you. And thanks, Jen, for what you do.
Thank you, Marsha. And wonderful to hear two very different associations and the impact that you've had. And I really love that proverb as well. That's absolutely fantastic. And great to see nurses and midwives from ethnic minorities going to more senior positions. That diversity across the leadership is so, so important. So I'm going to hand across to Saj now to share his insights from the Malali. I've got to get better at saying that, haven't I? Saj, over to you when you're ready.
Yeah, thank you. I'm here. I'm ready. Thank you, Lucy.
Lovely. Thank you for joining us.
And thank you for Florence Nightingale Foundation and NHS EI for the support given during the last 2 years. So I'm Saj. I'm here on behalf of the Union of UK Malayali Association's Nurses Forum. I was the national coordinator last 3 years. We are an organization which is democratic, so we do have elections every 2 years, giving the opportunity for nursing leadership for everyone. So I'm stepping down from my role as a national coordinator, so you'll see new faces coming in this year. So just a brief introduction about the UKMA. Is Union of UK Malayali Association. It's formed in 2009. It's a non-profit organization working at a national level. We have 10 regions in the UK and 130 associations. So this is an umbrella organization of the 130 associations. And I don't think all the 130 associations will be able to get the membership in the INMA if they wanted to. So we collectively work for them. So it's working national level. Its aim is to promote the fellowship of its members through the cultural exchange involving artistic, literary, and the integrational needs of the Keralite community living in the community. So Kerala people are those from the state of Kerala, a southern state of India, speaking Malayalam as their mother tongue. We have around more than 38,000 nurses who are educated, trained in India, and the majority of the Indian nurses are from Kerala, believe it or not. So majority of the members of the UKMA are from the state of the nurses. That is how we have the nurses forum in the UKMA. So our activities are multifaceted and is a cultural, political, professional, and social. We like to get involved in almost all aspects of the pastoral care for the newly arrived nurses. Next slide, please. So some of the cultural events which we do have something called a Kerala Puram, which is one of the state festivals celebrated back home. It's just a resemblance of the same event, like a snake boat race. The last one this year after the COVID, we did it in Sheffield, Rotherham. That was on the 27th of August, attended by more than 10,000 people, and it was a grand success. The other type of event is called a National Colour Mela, which we give the opportunities for the nurses or the members of the Malayali community and their children showcase their talents, their cultural, and it's a competition. So we do regional competitions first, and the winners of the regional competitions will attend the national ones. And the National Colour Mela are done in the different parts of the country. The last ones were one in Sheffield, the last one in Manchester. Due to COVID, we had to do it online, which we successfully did it with more than 500 participants, so showcasing their talents. This year, the face-to-face one is going to be conducted on November 5th in Cheltenham, so all are welcome to join and watch the program if you're interested in the Indian and Kerala cultural and art showcases. Next slide, please. The political, we also getting involved in the political aspects that is affecting the nurses, especially the internationally educated nurses. 90%, our members conduct 90% of the MPs in the country in their own constituencies and return to them about their concerns about the salary increase. So that was done during the COVID time, and we returned to the Home Office and Shadow Secretary tried to influence politically on the salaries and also on the health surcharge. And it was lovely to hear from the Home Office back that they removed the health surcharge during the COVID time, probably you all remember. And we were one of the organizations that tried to influence that. Next slide, please. Professional, so thanks to FNF and the NHS-EI for the grants given this year. And from that, using that grant, we managed to meet and greet and welcome nurses in the different parts of the country. All of the programs were very successful, and we managed to get the representatives from the each area, the chief nurses or the deputy chief nurses from the NHS organizations. We may be too much to say, but we may have more than 100 people who are speaking the language Malayalam or from Kerala working in every single NHS trust in the country. And most of them, even though we are the most represented single INMA, it's very sad to say that we are most underrepresented in the senior bands in the NHS as well. Probably there is only one 8D. There is no one more than that. There is a few 8As. There is a very limited 8Bs. And some of these organizations in places where we did, there isn't even a single 8A from our representative. I'd like to take this opportunity to raise that concern as well. But hopefully we provided some the professional advice, career development advice during these sessions we did. And I'm glad to say that myself tried to or supported more than 10 colleagues reaching from a band 6 to 7 who've been in this country more than 20 years. So that is a good success, and thanks to FNF for giving the grants and providing this opportunity to have these career clinics in the different parts of the country. And these are some of the examples. We have done more than these. Next slide, please. Our social commitment back home, we all trained back home in Kerala, and during the COVID time, we try collectively organized a telemed service, which is a peak of the COVID in India for people to contact for advice and for video conferencing. The medical facilities were provided by volunteers from different parts of the country and from UK, the nurses and the doctors, and we tried to coordinate that. And that program was inaugurated by the health minister back home in there, and that was a huge success as well, and all worked done voluntarily. Next slide, please. Again, thanks to FNF and the NHSEI, we managed to develop a dedicated website for UNF, and I'd like to unveil the website today. It's not been out yet. It's the first time we unveiling it, and thanks. And this website was developed from the grant which was given by FNF. It's still in the development stage, and there will be more contents will be added in the coming months. And this also worked again, the fellowship which was given, the INMA fellowship, the fellow worked hard behind this website, and that was another success story from the INMA grants scheme. So thank you all. If anybody who is listening to this wanting to join UNF, there is a link in the website where it says register. We are trying to increase the formal membership of our organization. So welcome all, and thank you again.
Thank you so much, Sergeant. So interesting to hear the impact that you've had, an enormous impact. 10,000 people at one event is incredible. And I'll be sharing some opportunities for internationally educated nursing and midwives. And I notice our Global Director, Stuart's here with us. And we're just about to open a new programme focused on leadership capability, but we'll talk about that a bit later. So next, thank you so much for sharing, Sarge. So next we have Oliver with us from the Philippine Nursing Association. He's going to share his own slides. So over to you, Oliver, when you're ready. And thank you so much for joining us. It would be great to hear the work that you've been doing in the Philippine Nursing Association.
Thank you, everyone. Before I start, just want to say massive thank you for giving me this opportunity to share this platform with Marcia and with Sajan. I think it's so inspirational to hear all the work that is actually being delivered by my fellow colleagues across our international educated nurses. So just to, hopefully everyone can see this now, I think, yeah. So we are the Philippine Nurses Association UK. My name is Oliver. I'm the current president of the association, and the association is founded in 2003. We are under the Charities House, so we are a non-profit volunteer professional organization. So I'll be quickly jumping straight away to like the successes that we've had. So what I want to actually share is like the trajectory of our membership. As the same as with some of the other association, our membership is for free. We made sure that like it's a free access to our Filipino colleagues across the UK. So you can see that from 2020 to where we are now, we have jumped almost kind of like 4 times of where our membership is now. Our reach within the social media has been increasing as well. And thanks to the support coming from NHS England and the Florence Nightingale Foundation, not only about the grant that we receive, but also the skills that they have shown to us on how we can actually promote ourselves has been very, very helpful. So some of the successes that we've been focusing more in supporting our internationally educated nurses from the Philippines that newly arrived in this country is facilitating what we call the Informal Onboarding program. So for the past 2 years, we've been facilitating this program every weekend. And this is a supplemental support for the pastoral care that they're already receiving from the different trusts that they're working in. Normally in this event, we speak about very quickly about the area, the transportation and communication that they will help. That will help them to actually settle in working in the UK. So we've been reaching out normally for the past couple of months, virtually all those newly arrived nurses, and some of them as well are like nurses who are still in the Philippines who are due to actually arrive here in the UK. Addition to that is like once we know where they are with the grant that we received, specifically the Omicron package grant that we received from NHS England and Florence Nightingale Foundation, we were able to actually provide what we call the pastoral packages to different parts of the UK, and supporting and meeting up with new nurses arriving and making them feel that like the spirit of community amongst ourselves to kind of like identify what are the pitfalls, what are the challenges, and as well as like what are the support that they can get from the different services from the trust that they're working and also from the association. Also to support our international educated nurses, the first quarter of this year, we facilitated a free OSCE webinar to support our staff or our newly arrived nurses to kind of like prepare themselves in their OSCE testing. Now, what we're making sure is like this aligns with the national agenda about the OSCE testing, as well as kind of like supporting them, having a supplemental sessions added to what they're already receiving from the trust that they're working. We are due to start our next batch of OSCE webinar this month. So there will be 10 stations that we will be facilitating. So that will be done every week. So watch out for that information. And additionally, we're also focusing for our Filipino colleagues who's been here in the UK. So we've been facilitating a lot of health and well-being programs since 2020. Including on that is about building their psychological resilience, some health and well-being programs in sleep hygiene, exercise, as well as for healthy eating. Additionally, we also focus on how to support them financially about being knowledgeable of the work that they're doing. Equally, we've been facilitating different interview skills and collaborating as well with different associations with different webinars, including the midwifery webinar that we had in October, as well as about knowledge on how to become a mental health nurse here in the UK, where we collaborated with our British Indian nurses colleagues. So the current program that's taking place, and thank you for the NHS England grant that we received. We are now facilitating a free mental health first aid course initially to our Filipino colleagues. By the end of this month, we will then be able to train and certify 32 Filipino nurses to be mental health first aid. So it's one of our success story because we know very well that like during COVID, mental health challenges has been a bigger issue. So I mentioned about the World Cafe Convention. So the first Cafe Convention that we had was in 2020. This was all virtual and we had 370 participants. In that event, we had a competition of like Filipino colleagues presenting their poster abstracts. And one of them was actually chosen as the winner, and that was actually published in the Physicians Journal. And the second PNA World Cafe Convention was a hybrid one where we were able to actually have a face-to-face and a virtual event. So in that occasion, we also had around 350 dialing in to see, coming from all different parts of the world, mostly from the Philippines as well. And with that event, we had our nurse leaders in the UK, including our leader from Florence Nightingale Foundation, Professor Gemma Stacey, from our colleagues from Mary Seacole Trust, Lisa Rodriguez, and nonetheless our CNO Ruth May. Additionally, we were so proud to actually showcase as well the work that our first Filipino VSM or very senior manager, Mr. Edmund Tabay, joining us on that event. Equally, we made sure that this engagement is also aligned with what's happening in the Philippines. So we were able to actually invite our Secretary of Labor and Employment, Secretary Bello, during that event. Such a very successful one, but like it's always a challenge because people to actually know organizing this is not an easy fit. So we are looking forward to another World Cafe Convention in February because in November, we will be having our graduation for all those who have passed the mental health first aid course. So how do we share this success? First and foremost, in 2020, we did a evaluation on what we call emotion behind the mask. And this was actually in collaboration with other charity organization here in the UK, and we were able to actually publish this. And this year, we were able to do a poster presentation, and we were invited by Florence Nightingale Foundation to share the work that we've been doing. And equally, there's always a big work about working in partnership with our colleagues from the INMA, as well as from the different organizations. So we've been collaborating with our partner association, the Filipino Nurses Association UK as well. And this event took place last year where we were able to actually share the work that we're doing to our ambassador in the UK and the UK ambassador to the Philippines. So what we ensure is that we continue the work that we're doing about diversity and inclusivity. So this year, we were able to actually parade on the 50th London Pride event. It was a success for us to be visible, for us to be known on the work that we're doing. But equally, I think personally, I just want to actually emphasize the other work that I'm so proud of is that making our organization more diverse. So even though our name is Philippine Nurses Association UK, we now have a midwife lead, we now have an OT lead, we now have colleagues working in social care as well as from the private sector to actually join in our association. So we're ensuring that we're able to capture as many Filipino nursing colleagues and allied health practitioners to join our association. So we're very active. I think Jen did mention a while ago, and our association is quite young. We've got so many talented millennials who are able to actually do our website. Website has been up and running for a while. So here are the details. We've got our website, our Twitter account, and our Facebook. We are now active as well on Instagram. So watch this space because the next stage is TikTok, which is, I don't know how to work it out. Thank you for listening and thank you for giving me this platform and the support that everyone's giving. Thank you.
Thank you so much, Oliver, and so much great work again that you've shared and hope inspired everyone that's attending today. And also we're recording today as well, just to reiterate. So for those that can't attend, we'll share that with our members and alumni and supporters as well. So quite a big audience that we'll be able to capture. So we're going to go to a Q&A session now. But before we go to that, I just wanted to share some really key points that I think each of you raised was around making sure our diversity and more senior positions across the healthcare industry, not just within the NHS, but across all areas, independent, hospice, community, etc., that we touched on. And what's really great, we've got quite a few opportunities coming up at the FNF. I'm going to lean to my colleague Stuart in a moment, didn't want to put you on the spot too much, Stuart. We will be opening up for places for a newly designed and fully funded programme for internationally educated nursing and midwives. We've got 1,000 places, and that's across all 4 countries. When I say 4 countries, I mean you're obviously practicing within the UK 4 countries. That'll be Scotland, Ireland, Northern Ireland, England, and Wales. And that's 1,000 places, a year-long programme, looking at how you can really develop your leadership capability, raise your voice, have greater impact and influence. And that's open to Band 5 right through to the Band 7 nurses, but we've focused on obviously internationally educated nursing midwives in country, but also those that are newly arrived as well. Stuart, I'm sure we'll share a bit more information in a sec. We've also got our scholarships open at the moment. I really would urge each and every one of you, and this is for anyone who's listening on the video as well, please do apply. They're open at the moment, they close on the 21st of October, and they're open to everybody from Band 7 and above, but from any background and diversity. So nurse and midwives, please do apply. We really want to see you excel and get into those senior positions across healthcare. We need to make sure that our senior leaders are representative of the populations that we serve. So please don't delay. Please do get your applications in. And we do have a video that you can watch as well, just to help with a successful application to give you the best foot forward. We look forward to seeing lots of applications from you all. And then finally, we are working on a fellowship program, which Jen touched on just now. Please do watch this space. That's for people that are fellows that are associated with the International Nursing Midwifery Association. Again, to give you a foothold, improve your leadership capability, finding your voice, stepping up to authority. So watch this space, lots and lots of interventions to help your career development and your career progression across the healthcare sector within the UK. I'll stop talking now and I'll share a bit more details in a minute about our upcoming webinars. Stuart, before I move on to the team, would you like to just quickly introduce yourself? That would be a wonderful opportunity to introduce our wonderful new Director of Global, Stuart Tuckwood. So over to you, Stuart.
Thank you very much, Lucy, and thanks for the nice introduction. Hi, everybody. I think I know most of you, to be honest, that I've met you before, but it's great to see you in this new job role that I have, this great opportunity at the Florence Nightingale Foundation. Thanks to everyone who's presented. That was really interesting to hear about your work. And every time I listen to it, it's always amazing to hear all the new different things that you're exploring and the new ways you've found of supporting your nurses and midwives. So really great work. Lucy, I think you've said a lot about the leadership program that's opening tomorrow. So I don't have too much to add, but just to say it's a really brilliant opportunity. It's a great program. We know that this, as Lucy says, there's a real need for those kind of opportunities for internationally educated nurses and midwives, particularly those working in social care and other settings who might not be able to get on NHS funded courses, etc. So We've got 1,000 places to fill, which is the biggest program we've ever run. So it's very ambitious and it's very exciting, but we're really going to rely on your help in terms of spreading the word and making sure we reach as many people as possible to take part in that course. And we've actually had internationally educated nurses and midwives subject experts working with us on designing that course, which means that hopefully it'll be really tailored and bespoke and meet the needs of our internationally educated nurses and midwife colleagues. And really interestingly, as part of the course as well, we've filmed a number of the organization is called Patient Voices, but they've produced videos about the stories of internationally educated nurse and midwife leaders who've gone through that journey and achieved success and got into really influential positions. So it'll be really interesting to see how that works as part of the program. We're getting a sneak preview of those videos tomorrow, which is really exciting. So I'm gonna have to get some popcorn out and the tissues as well, I think, because I think they're gonna be really emotional. So yeah, applications open for that tomorrow. So really look out for that and help us advertise, and that'll be great. I just wanted to say very quickly as well, you've probably already said it, Lucy, but a huge welcome on my part to Jenny, who's joined us as our head of global at the Florence Nightingale Foundation as well. I'm sure you all know Jenny very well, and she's bringing a real wealth of expertise and knowledge and perspective to our work at the Florence Nightingale Foundation. So I'm very excited to work with her. And finally, from my point of view, there was really interesting to hear from your different presentations, some of the work that you're doing to support your colleagues and your home countries where you were educated or where you came from originally. And as well as the work that we're doing to support nurses and midwives in the UK, there are going to be more and more opportunities coming up as part of the FNF Global to try and do more to support leadership and development opportunities for nurses and midwives around the world as well. So if you didn't already have enough work, I'm sure we'll be knocking on your doors and asking for you to contribute to that and help us out there as well. So really exciting, really great to have a chance to meet you all. And thanks again for all the work that you do. Hand over to you, Lucy. Thanks,
Stuart. Thanks so much. Thank you. So I think there's a lot of congratulations for you, Jen, in your new role. I think we're just absolutely thrilled to have you as part of Team FNF at long last. So over to the audience, and if there's any questions you wanted to ask, if you don't feel brave enough, please feel free to pop something in the chat and I can ask on your behalf. I've got some questions to ask the team as well. If no one's feeling brave enough, go ahead. We'll give them a couple of minutes. Oh, brilliant. Sarita, hello, welcome.
Hi, hello. Thank you, Lucy. Hi, everyone. My name is Sarita, and I'm a Florence Nightingale Digital Leadership Fellow, currently working with NHS England, with Natasha's team, the CNIO of England. I came to UK in 2004. It's almost like 2 decades now, and the UK became my home at the moment. I was really interested when I saw this webinar on the Twitter. It's nice to know that there are many associations, the INMA, and unfortunately, I don't know about them before I could come to the FNF, before I was a scholar. So just wondering, I'm a very senior nurse who has been here and you know, I haven't known much about these organizations or these associations exist. So it would be the same to so many of my colleagues in my region or within the ICS or the east of England. So I'm just wondering, what is there any plans to increase more awareness or to, you know, just spread the message over? Because I heard the message from Saj about the UK Malayali Association, but just talking from the point of India, I mean, India is a multilingual country with more than 30 plus states, and we have nurses from all over the country, about I would say thousands at the moment working in UK. I know there is a Malayali association now, but just wondering about the nurses from the other states, you know, is there, I know there is BINA, which is British Indian Nurses Association. Unfortunately, there is no representation here. Maybe I'm not really sure what the reason was, but do they, you know, do they do something for the other nurses or anything? You know, I myself don't know much about it as well. So it would be really good because I'm very happy to be involved in this, and especially, you know, as a nurse settled in UK, I have a real passion to develop my nurses back home as well. And I sort of like for my project for my FNF as well, I'm trying to link in, you know, come up with some sort of a network or something. And this would be a real good thing to do. So any suggestions or any information there, I would greatly welcome as well. But it's really nice to be here. I don't expect any answers from this webinar at the moment. Just putting the thought there that, it's really nice to have that sort of an association, just wondering what is happening to the other nurses. Do they know the message? Do they know that there is support, or we can extend some support to them as well? Thank you.
Thanks, Sarita. Lots of many good points. So I'll answer a couple, and I will, Jen, I'll warm you up just so you're ready to answer as well. So we do, as we said, we've gone from 4 INMAs, very well established, to 24. So always looking to expand that network and support internationally educated nurses and midwives. So Sarita, Jen can certainly help with you setting it up. With regard to sharing the message, please do share far and wide. And at the end of this webinar, we'll share details of how to get in contact with the 24 formed INMAs that we currently work with and beyond. So Jen, I'll pass across to you for how Sarita can kind of get in touch and get further information as well. Anything you'd like to add?
Yes, I'll put my email on the chat box, but at the same time, Sarita, the aspiration is we really want them to nurture and support emerging associations. So if you think, it doesn't cover your region, because we know India is so big. So on my scope at the moment, we have the UK Malayali Nurses, British Indian Nurses Association, and we have Rohit here with the British Sikh Nurses as well. But that's just 3. And I am mindful that India is the second largest nationality in terms of our international workforce, and we'd be happy to support.
Wonderful. Thank you very much, Jen and Lucy. Thank you.
Oh, absolute pleasure. And thank you. A really valid, very valid question, should I say, all very good points. I think we've got time for one more question before we finish up, unfortunately. And Sarita, just your point about other associations, this is the first in the line of the webinars, webinar series that Jen and Stuart will be taking forward to hear from the other associations as well, their successes. Just to make
wonderful. I look forward to join them too. Thank you very much, Lucy.
Great. Any other questions before we finish up today? Well, probably time for one more. Great. I think I'm just going to give some feedback that's come in the chat, because I think it's lovely. It was a direct message to me, but I'm sure Judith won't mind. Judith Ellis has said, a great and fascinating event, such lovely, enthusiastic and dedicated nurses and midwives. You should be really celebrating the successes of the work that you're doing. Well, great, Wasim. Wasim. Thank you, Wasim. Thank you for joining us.
Hello, good afternoon.
Good afternoon.
Yeah, I just want to mention about the Pakistani Nurses Association. And we are very less in number, but we have a quite good network, and we are trying to establish more network. And FMN, I know Florence Nightingale Foundation, and I applied myself, and I encourage many others to apply for the scholarship. And I suggest long time back, like as ICN doing the international work, then Florence Nightingale Foundation also do that. And I'm quite glad to hear about that. And I'm hoping to work, and I will get also myself scholarship, and few of my comrade and my association member also will participate in the future activities.
Brilliant, Wasim. Thank you so much. That's great to hear. Please do help us spread the word. Obviously, we've got 1,000 places. We really want to fill those and make sure everyone gets the opportunity. And beyond that, we've got lots of the courses as well. So great to hear talking about the scholarships too. We really want to see a lot of applications from our international educated colleagues. So please do submit and don't delay. Well, sadly, we've run out of time, which is always a shame. These hours always go too quickly. Just to make you aware, the next webinar in our series is how to be an ally, which we're really excited about. It's on the 27th of September. So please do join. Obviously, we'll record it as well if you're working for other commitments. You can catch up on our YouTube channel if you can't make it. But it's really good. This is with David Corbin, who's done the patient stories as well. Stuart was talking about earlier. And Emma Simmons as well, again, who are giving their perspective on how to be a good ally. So it's a really excited about the upcoming webinar. So 27th of September, hold that in your diaries. Just to make you aware, the recording will be ready in a couple of days' time for you to access. Please do share with your colleagues who weren't able to make it, and please do share the opportunities far and wide. In our email that we follow up with, we'll share details of the courses, how you can apply, send you links to the scholarships as well, and also how to get in contact with the INMAs that we've spoken about, the 24 that we're in contact with. If you'd like to see further INMAs set up, please do get in contact with Jenny, myself, or Stuart, and we'll signpost you and let you know what you need to do. Thank you all. Have a wonderful afternoon, and thanks for joining us. Take care.